update. It's now been 6 months since my gastric bypass surgery. My highest weight in April of 2011 was 401 pounds. My weight the day of surgery was 297 pounds. So I've lost about 64 pounds since surgery and 106. Things have been going really well, just trucking along. My weight loss has been a little slower, or, a little bit different than some other people. I've been noticing that I'm tending to lose a little slower than other people, but many things could play a role in that. I also did lose 104 pre-op, so I'm not too worried about it. I still have a good year of losing, so I'm pretty happy with that. So I did an update in about 5 weeks. A lot's been going on. I'll get into that a little bit. But I'll get into my numbers first. My last video, I believe, was, like I said, 5 weeks ago, and I was 237 pounds. My current weight since then is 233. I've been stuck in a nasty stall now for about 3 weeks. I haven't really been losing anything. If anything, I think I'm on the dreaded 6-month stall. I don't know how it's gonna last, how long it's gonna last, or when it's gonna ease up, or what I'm gonna do to jumpstart it this way. But for now, I'm just trying to stay away from the scales and hoping the weight starts moving again. So, I'm really happy with my weight though. I definitely do want to lose some more, obviously, but I have lost 167 pounds total, the 64 pounds since surgery, and I mean, I've having like a lot of scale victories, and I'll get into some of that. Like, I was able to go into Gap and buy an extra large pair of sweatpants. Granted, they are a little stretchy, but they fit me, and if anything, they're a little baggy, and I don't remember the last time I bought anything from Gap, ever. Never mind, like, an extra large. I haven't been in that size in forever. I'm wearing between a 16 and 18 jean, depending on the brand and the make and the fit and all that good stuff. Shirts, I am wearing a 1X. 2Xs I'm noticing are really big, but I can fit into a lot of extra larges as well. So I've been doing that. Let me see what else. So some other things that are going on with me. I have had some medical stuff coming up, some related to surgery, some not. So basically, I had a tooth pulled like 4 days ago. So I've been on antibiotics for that and pain meds again. So I also am dealing with what we think is an ulcer, or my gastritis flaring back up. If you guys remember my video update from back in like April, I was diagnosed with gastritis through an endoscopy and acid reflux, which I already knew I had. So I saw my surgeon today for my 6-month post-op checkup, and we are going to do another endoscopy. I'm also going to see the gastroenterologist that's going to do the endoscopy, because he's the one that did my other one. Not to mention, I'm dealing with a lot, and I mean a lot, of constipation issues since surgery, and it's still going on. And every so often I'll be okay, but most of the time it's just not letting up, regardless of what I'm taking for it. I've pretty much been taking Coley straight for, goodness, since surgery, and I'm taking 2 of them a day. And I usually do Miralax daily, 2 capsules. When I get desperate, I do milk with magnesia. I'm even at this point sometimes heading towards the enemas, which I really don't want to, but sometimes I just don't have a choice. So yeah, constipation for me has been an ongoing issue. Not everybody has that problem, but I have. So yeah. So I'm going to have another endoscopy. I'll let you guys know how that goes. Hopefully in the next couple weeks I'll have that. So between that and my tooth, which is infected and it got pulled, so I'm on antibiotics for that as well. I'm back on the Carafate for just in case it's an ulcer or the gastritis acting up again. So I'm back on that. I'm also having surgery September 30th. It's a day surgery under general anesthesia, but it is only a day surgery, and it's not related to my gastric bypass at all. something completely different. So before anyone gets nervous thinking, you know, I'm having surgeries related to my bypass, has nothing to do with that. So yeah, I've had a lot going on, trying to keep up with doctor's appointments and stuff going on, and, you know, still trying to eat and drink what I can without being in pain or throwing up. The nausea is kicking my butt lately because I'm in a lot of pain. So, food-wise, I am eating, what is it, anywhere from a quarter of a cup to a cup. I usually never ever go beyond a cup because I get full way before then. The restriction's definitely still there. I mean, I'm only 6 months out. I am having a lot of protein. I'm supplementing lately with protein shakes again, like the ready-to-drink pure protein shakes. The ones I get at like 180 calories and like 35 grams of protein. And right now with like the ulcer situation, and it's helping me a lot keep on top of my protein because I'm just not getting enough protein otherwise. Besides that, I do like my Quest protein bars, at least one a day, which has 20 grams of protein. And I'm also doing a lot of like things like steak tips. And I know some bypass patients have a hard time with things like that, like red meat, but my pouch loves it and I have no issues with it. I just chew it really well and it goes down well, so that's good. Um, what else? Mm. I said it's been forever that since I've done a video. I'm gonna do a separate video to touch base on a few things. One is gonna be the constipation, and the other one is I'm gonna like touch base a little bit with people on the loose skin post-op. Like I said, I've lost 167 pounds, and I still have about 83 pounds to go to get to my goal of 150. But I would be okay at 172. I'm not like saying 150 has to be the ultimate number for me. I think I'd feel really good at 170. I already feel good now, but obviously I still want to lose some more. I'm not ideally where I want to feel good at yet. I mean, I'm out of the morbidly obese category, but I'm still obese according to the BMI charts. So yeah, I mean, I definitely want to lose. If I want to get to 170, I have around 60-ish pounds to lose, and I think that's definitely doable considering I'm only 6 months out. So hopefully that weight starts coming off soon. I'm hoping, secretly hoping that whenever the stall ends, like I have like this miraculous like 15-pound loss. I know that's really pushing it, but considering I haven't lost in a while and my losses the last couple months have been pretty slow, like lower, I'm hoping that'll be the case, but we'll see. Crossing my fingers. Um, my herniated disc for my back has been acting up a little bit again, so I'm going to be having another steroid injection for that soon. I got to finish my rounds of antibiotics before I have it, just because it's a spinal injection, so they don't want to risk anything getting up in there. So, yeah. Vitamins, I am still doing the bariatric fusion. I'm doing 4 chewables a day. I'm also supplementing with a calcium chew from Bariatric Advantage. Usually daily, just one chew. I took like, I switched vitamins for about 2 weeks and was doing this. But to celebrate, you have to do the multi, you have to do the sublingual B12, you have to do a separate iron, you have to do the separate. So, I just wanted to switch vitamins and try them out only because of the constipation issues. I heard that sometimes iron can be a cause of that, and some irons are less constipating than others. So I didn't really help me at all, so I went right back to fusion. I just got my 6-month labs back today, and they're absolutely perfect, so they're because, you know, I mean, it's just one less thing I have to deal with at this point. I already have, like, my hands completely full. Hanging skin is definitely something I'm going to talk about. I'll probably make a video show you guys. Granted, I have enough courage to lift up, show you guys all the skin, but it's definitely there. Look out for that. It will be coming up soon. Maybe in the next, maybe tonight, maybe or two. So, what else? What else? Big, big, big victory. So last July, I got diagnosed with obstructive sleep apnea. I was given a mask and the machine that I had to use. And I had a second sleep a week and a half, 2 weeks ago. And I had my actually yesterday with my sleep doctor. And from what they saw on their side, I guess it's apparently gone. I mean, there's no more sleep apnea. I spent at least 50% of that time on my back. The sleep is where like a lot of my episodes were popping up, and they did get me a little bit, and nothing showed up. So I am beyond stir machine's already gone, packed away. See you later. Don't want to see you again ever. My doctor evicted me. Apparently, I'm fired and not allowed to go back anymore. And trust me, I don't plan to. No back to that again. So, I mean, the weight loss has been piping down quite a bit, but a lot of huge things going on in the meantime. I mean, sleep app gone. That was like a big one I hoped for when I wanted to have my that I'd be able to get rid of the sleep apnea. And sure enough, so if you're still questioning the surgery or whether you think you should do it or not, because I know I have subscribers that my videos obviously, and I don't want to scare any of you that are seeing my issues and thinking this mistake. I don't want to have all those issues. Just know, and I'm going to clarify it, that not everybody is the same. We all lose at different we all have different stalls at different times in the weight loss journey. Just because I'm severely half the time doesn't mean you're going to be. Just because I have ulcers and gastritis doesn't mean you're going to be. So don't let my video you guys off. I just like to make my videos like as completely cool. So if any of you have any questions, feel free to write it on the bottom and I will respond as soon as possible. But yeah, I love the journey. I'm still going through it. I don't take back anything. And even with the stuff I've had going on, if you would ask me today, like right this second, would you do it again? Absolutely. I wouldn't even second guess that decision. I mean, everything is great. I've never been so energized and full of life and happy. Coming from someone that's been obese since I was a teenager. So never question yourself. This journey is absolutely worth it. So I'm going to try to get my video in on time for my week 30. I usually skip every other week. I try to do a week 30 update, maybe a week 29, but I can't promise anything. With my surgery and everything coming up, I'm going to try. So I hope you guys all have a good night. Watch for my video on hanging skin. That's going to be the good, the bad, and the ugly. So, you guys all have a good night. Bye.